Well, May is Mental Health Awareness Month, and each Monday of this month we'll be putting a spotlight on different aspects of mental health in specific areas. And this week we want to start with adult mental health and the importance of seeking help when needed. Joining me to discuss this issue is the Executive Director of the National Alliance on Mental Health Illness Idaho branch, also known as NAMI Idaho, Beth Markley, as well as Optima Idaho Associate Director of Clinical Operations, Dennis Boffman. Thank you both so much for being here today to discuss these important topics.
Thank you for allowing us.
Of course. So, Beth, I wanted to start with you now. Of course, you've mentioned you have personal experience in this field. So, would you mind telling us a little bit about a family member you have with mental illness?
Sure. We have a loved one. My husband and I are taking care of someone who in our family who has serious mental illness, and we've been working for a number of years to find resources and to navigate the mental health field. It's been tricky and a little confusing, and actually the opportunity to work with NAMI came up midway through that process, and I said, well, I wasn't really familiar with NAMI and the resources, and so it's a wonderful opportunity to kind of blend a couple of different passions of mine.
Gotcha. Now we're going to get into NAMI in just a second, but I wanted to ask you, when was it that you became aware that there might have been a mental health problem within your family member? Well,
so mental illness, I mean, it can crop up at any time, but about 75% of the time it can be diagnosed before the age of 14. And 50% before the age of 14 and 75% by the age of 25. So when a family is experiencing an issue with mental illness, likely it's that of a young person, an adolescent. And you know, the first signs of mental illness might be someone withdrawing from family or isolating, sleeping a lot, difficult to deal with, a quick temper, risk-taking. A lot of the signs that come along with adolescence, right? So it can be a little bit difficult to discern. And some of those risk-taking behaviors might be self-soothing measures, right? To try to cope with the issues that they're dealing with, such as substance use and so forth. So it can be really tricky at first to diagnose properly a mental illness. And at first we were dealing with generalized anxiety disorder and depressive disorder. And then later blossomed into schizophrenia, which is a serious mental illness that affects about 1 in 100 people in our society. So, so we've been dealing with this for quite some time, and it's taken two fairly functional adults a great deal of time and effort to figure out what the diagnosis was, to navigate these systems, get help, and keep on a track, because recovery is possible. Yeah. Living a full, productive life is possible for people with mental illness, but they need a strong support system. Mm-hmm. And it's not always completely apparent where to find that. Yeah,
that all makes sense. Now,
can I add one thing to that, Beth? Is that all right? Well, first, thank you for sharing your story. That's always challenging. The other thing I want to emphasize is, we as parents, if we're concerned, if we're seeing something, I think you did a fantastic job of showing sometimes the challenge that what is the beginning of a mental illness looks like normal adolescence. But if you're concerned about your child, talk to your kid's pediatrician. Talk to the various individuals in your life looking to begin getting to supports, because the system can be challenging to navigate sometimes.
Yeah. Now, Dennis, I wanted to ask you, when it comes to public perception of mental illness, what are you finding?
So I think what we've seen occur is people are beginning to feel more comfortable. There's lots of individuals, sometimes very public individuals, that are willing to express and share about their challenges. Some major professional associations have athletes that are taking time off and are publicly explaining that they're taking time off due to anxiety or depression or other mental illnesses, which is fantastic. However, there's still a long way to go. There is stigma, fear, anxiety in talking about what's going on. There's also situations where sometimes we look at people, or the community looks at people that are struggling with mental illness as something is wrong with them, and that's not the case. So we've come a long way. I want to acknowledge that, but we have a long way to go still to where we can have a community where people are able to and feel comfortable expressing all their difficulties and the illnesses and challenges they're struggling with. Anything you'd add?
I think in Idaho, in particular, we have a individualistic, rugged kind of persona that we buy into, and we're very proud of. At the same time, you know, this mental illness is a medical illness, and it's not, you would never tell somebody with leukemia to just power through it, right? You would never say to somebody with a broken arm, just get back out there. But we say these things to people with depression, we say these things to people with debilitating anxiety, and we look at what they're going through as somehow an evidence of fault or blame,
moral failure,
or a failure of character. We say things like, "This never happened in my family." We don't step up for people who are dealing with these challenges in their own families. So, you know, if you're a person at work and you have a colleague who has a child with leukemia, you might say, let's rally around that person, pick up some extra shifts. Let's make sure that they're feeling good. Let's take her for a girls' night out because she's having a really rough time of it. And there's no one sets up a meal train for a mental health crisis, right? Nobody's like checking in with people who are dealing with that. And those, parents and spouses and loved ones, they're coming to work anxious about their loved one, unable to really function as well because they've got a lot on their plate with this caregiving and not a lot of support.
Yeah, you're absolutely right. Unless I feel like it's something incredibly apparent, unless there's a specific diagnosis, you have cancer. Okay, well, I know this now, and there's things, but I mean, with mental illness, I mean, it's not necessarily apparent to everybody. So, well,
and that's the other thing is it takes an average of 8 years to properly diagnose a serious mental illness. So in that amount of time, there's a lot of, I don't know what's wrong with this person I'm caring for. They're very difficult to deal with. They're putting themselves in harm's way a great deal of time, and it just feels from the outside sometimes like maybe this person needs a little bit of tough love. Maybe they just need to deal with the consequences of their actions, when in fact they have a very real issue that they're dealing with. And sometimes when they don't get that kind of support, they're also coping with substance use. So substance use disorder is something that is co-occurring with a lot of mental health issues because a person is simply not able to find the resources that they need to adequately cope.
They're trying to soothe, kind of deal with all the stress and challenges they're having. And I think to add to that point too, as individuals are going through the experience of trying to find the right diagnosis, trying to find the right treatment, there's often a lot of treatment failure in the wrong therapy, the wrong medication, the wrong program, and that can add to that additional stress. And we're trying and nothing is working, and can kind of really create a sense of hopelessness and a sense of, it'll never get better, which is not the case. Recovery can happen. People can get better, which is really why I'm excited to hear about all the resources you guys have.
Sure.
Yeah. And that's a great segue right there because, and especially I wanted to mention something that you had mentioned here in Idaho specifically, tough state. Rugged state.
Right.
People, I would assume, especially males, don't want to talk about these things, don't want to talk about mental health issues in so many cases, but there are resources to help with mental health issues. For example, the National Alliance on Mental Illness, or NAMI Idaho, which you're associated with. What exactly is NAMI and the mission behind it?
So NAMI was started with a grassroots effort in the 70s, shortly after deinstitutionalization was happening, which is a much longer conversation, by a group of parents who were concerned about their adult children with serious mental illness and the lack of resources for them. So they gathered together, and just that solidarity with other families going through the same thing can be a really powerful opportunity for folks to really begin to understand that they can take charge of the situation and can control what they can. So NAMI Idaho has been around in Idaho in one form or another since 1991. For a while there during the recession, had a little bit of a hard time with funding, so it was a little bit lower profile until recently. We received a fairly large grant from a funder. We're able to hire some staff and really bolster some of the resources that we can provide. And the pandemic really pushed our organization to make use of the virtual space. So some of our support groups went online. We have people, you can join a support group from anywhere in the state or even out of the state.
Fantastic.
And you can also join support groups with other NAMI organizations if there's one that meets, with your time slot or with a specific diagnosis. Sometimes there are opportunities for that as well. So in person or virtual, there is a NAMI support group, and whether you're the person with a diagnosed or undiagnosed mental health issue or a family member, there is a support group for you.
Gotcha. Almost a different form of telehealth in a way.
Yes, it's not specifically therapy.
Right.
It's a facilitated. We have trained facilitators. It's a NAMI signature program. They get training, they get certification, they follow a specific format so that everybody can participate, and so that we are focused on recovery and empowerment, and just being able to share resources for family members and individuals.
Gotcha, great. Now, in addition to some of those support groups, what other kind of programs do you have at NAMI Idaho?
Well, we have several educational opportunities. We have our Family to Family group. It's an 8-week session that is specifically for family members with loved ones with mental health, diagnosed or undiagnosed. Family Basics is specifically for families with people under 20 years old who are dealing with mental illness. We have our peer-to-peer classes that if you have been diagnosed with mental illness, and it's basically, here's what the landscape looks like for mental illness, and finding treatment and finding resources. Here's what you might encounter when you're navigating through care providers and with medications. Here's how to advocate for yourself. Here's how to care for yourself. And then you're put in touch with other family members or individuals who have similar experiences, so that you can get that kind of empowerment and feel less isolated and alone, which can exacerbate any mental health issue.
Gotcha, very important.
Can I add to that real quick? I think that community aspect, which you didn't use that word, but it's the theme that I'm hearing is vital. That idea of, you're not walking this journey alone. There are other families that have gone through this. There are other families that can share their experience. There's other individuals, if you're the one with the mental health illness. None of us, even though that feeling comes up when we're struggling with mental illness, we feel alone. We feel like we're the only one going. And your experience is unique. I want to acknowledge that. But it really is that community that can come together, that community that can kind of support, provide education, provide additional information, and also sometimes just that individual to cry with and kind of resonate in, I'm scared for my son, I am worried about my wife. Whatever is going on for you, there's other individuals that have been through that, and they can walk that path with you. It's amazing. It's truly, truly powerful.
Yeah, great points.
It really can help to feel as though you are, as an individual, you didn't do something to bring this on yourself. There are other people who are experiencing it. There are other people who have lived through that experience. And particularly people are going to be in different places, whether you're in a current mental health crisis, whether you're learning about being, about recovery and where your place in it, or you're becoming an advocate. So those are different emotional stages for each individual, and we cycle through those emotional stages at regular times. And so in a support group framework, you're going to have somebody who is, their crisis is front center stage, and there are people who've been there who are focused on that is of the moment and what we're going to deal with now. And their emotional needs are going to be a little bit different. They're going to be in a place where they can provide that support. And I can tell you, whether you're a family member or an individual, it's life-saving.
Yeah, that's so important. I think just the phrase, you are not alone, is so huge for mental health.
That's why we have mental health. Mental Health Awareness Month is so that we can shine a spotlight on this for people who are struggling and for the people who support them.
Yeah, and on that note, how about the best way to get in touch with the people of NAMI Idaho so they or a family member can get help?
Well, we are decentralized. We have staff and volunteers who work from the comfort of their own homes, and so we're throughout the state. The best way to get in touch with us is through our website, NAMIIdaho.org.
NAMI.
NAMIIdaho.org. And then we have a calendar page that has all of the support groups and opportunities, classes, and things that we have. And each of those, you click through on those, and you can find out when they meet, how they meet, who the facilitators are, how to get in touch directly with the facilitators. All of those opportunities are free. They don't require any registration. And you can pop in a moment's notice. And then also there's a contact page, which if you fill out the form, that comes directly to me. I answer 3 to 4 of those emails a day, and they're generally emails from families who are in one stage of a crisis or another. What do I do next? And that's the biggest question I have. So those are the resources that we can offer.
Such a great resource there. And I wanted to ask about just other options or maybe ideas, Dennis, for people that are looking for help with their mental health.
So I think when individuals are looking for resources, I want to again emphasize being able to access NAMI. You've also got general community resources. So talk to your pastor, your minister, your rabbi. Talk to your doctor. If you happen to know of other individuals in your community that have access resources, that's always great. Also in our state, you can call 211. If you're in that crisis, you can call 988. And then obviously, you can always go to optimidaho.com, and we've got resources there, and also information about how to contact those other resources as well.
Perfect. Okay.
I want to go back to that 988. I think it's such a resource, and whether you are in a crisis or you are trying to triage, or you're calling for yourself or a family member, to call 988. Those folks, they keep notes on when you call. And the last time we talked to you, your son was doing this. Are we seeing a progression in this? They can help you, put you in touch with mobile crisis unit, or direct you to, is this a time for you to go to emergency room? Or just if you just want to talk and you just need to get, you need somebody who will listen. You don't have to be feeling, thinking thoughts about suicide or feeling like suicidal ideation. You can be just in a place where you just need that supportive ear, and it's just a wonderful resource. And statewide, it's free, and they will address what your needs are according to the community that you're in and what the resources are there.
And there's no charge for that too. I think I want to emphasize that too. It's important. Sometimes individuals, when we're struggling with an illness, whether it be physical or behavioral, mental health, we can be like, well, I don't have money to pay for that. 988 is a resource you don't have to pay for.
Great, very important to know there. And just going back to that phrase, you are not alone, certainly helps with that. Great. Okay, well, on the first Monday of May, which is Mental Health Awareness Month, is there anything else either of you want to add about adult mental health today?
I think, take advantage of those opportunities to let people know truly that they're not alone. If you have a work environment where you can invite someone to speak, to talk about stigma and mental illness, you can reach out to me or to other resources. There are folks who will come in and talk to your organization about the resources. You can get involved in any number of community activities. NAMI has an event coming up, NAMI Walks, on May 20th, where you can join us for free and have a great 5K walk on the Greenbelt, and that information is at the same NAMIIdaho.org website. But take this as a call to action, and be there for somebody who may be struggling, and also recognize, if you're struggling, that there are resources out there and that you are truly not alone.
Yeah.
I think the only thing I'd add to that is, and we mentioned it earlier, is recovery is possible. So, when we're feeling anxious, when we're feeling sad, when we're feeling down, when we're feeling suicidal, when our mood is fluctuating a lot, it can feel very scary, can feel very alone. And we've already talked and emphasized that you're not alone. There's resources. But in addition to that, recovery is possible. People can get better. Treatment does work, and we want to encourage people to take advantage of those resources.
Perfect. All right. Well, thank you both. And joining me today to discuss mental health issues has been the Executive Director of the National Alliance on Mental Illness Idaho Branch, Beth Markley, as well as Optum Idaho Associate Director of what was it? Clinical?
It's a Director of Clinical Operations.
There it is. Thank you, sir.
No problem.
Dennis Boffman. Thank you both so much for your time and the wonderful insight.
Thanks for the opportunity.
Thank you for the opportunity.